What if 40 million Americans lost SNAP benefits overnight? Imagine waking up tomorrow and realizing your food card balance reads zero. No warning, no explanation. 40 million Americans, parents, seniors, children, suddenly cut off from the food that keeps them alive. What happens when the backbone of America's hunger safety net collapses overnight? Let's find out. 1. Understanding SNAP, the lifeline of millions. The Supplemental Nutrition Assistance Program, or SNAP, is not just a welfare check, it's America's largest anti-hunger initiative. Every month, it helps over 40 million low-income Americans buy groceries, mostly essentials like milk, bread, fruits, and vegetables. SNAP keeps food on the table for 1 in 8 Americans, including nearly 12 million children and 5 million seniors. It also supports millions of working families who, despite having jobs, don't earn enough to cover basic living costs. Without SNAP, food insecurity in the United States would double overnight. The program doesn't just feed people, it sustains communities, stabilizes local economies, and even keeps grocery stores in small towns open. But what if it all vanished instantly? 2. The shockwave. When the system goes dark. Imagine this. It's the first of the month. SNAP deposits usually hit digital accounts. But this time, every card reads $0.00. Phones light up. Parents refresh their balances, assuming it's a glitch. Cashiers watch in confusion as payments decline. In just hours, panic spreads. Shelves at dollar stores, local groceries, and food banks are stripped bare. The people most affected aren't just the jobless. It's working-class Americans, single mothers, veterans, and disabled individuals. By nightfall, millions realize it's not a delay. It's gone. The U.S. has just lost its largest food safety net. 3. Food banks overwhelmed beyond capacity. The first domino to fall would be food banks. They already operate near capacity, feeding 60 million people annually. If 40 million new people suddenly turned to them, the system would collapse within days. Lines would stretch for blocks, supplies would run out, and volunteers would face impossible choices. Who gets food and who doesn't? Major cities like New York, Chicago, and Los Angeles would face chaos, but the rural South would be hit hardest, where SNAP participation is highest and local resources are scarce. For many, hunger would begin within 48 hours. 4. Economic domino effect, the market panic. SNAP doesn't just feed people, it fuels the economy. Every $1 in SNAP benefits generates about $1.50 to $1.80 in economic activity. That means small grocery stores, farmers, and truckers all depend on that spending. Losing $70 billion in annual SNAP funds would shock the food industry. Supermarkets in low-income areas, already operating on thin margins, would face bankruptcy within weeks. Job losses would skyrocket, especially among cashiers, delivery drivers, and warehouse workers. It's not just the poor who'd suffer. The ripple would reach everyone's pocket. 5. Rising crime and desperation. By week 2, hunger turns into desperation. Theft rates spike, especially in urban centers. Police departments report surges in shoplifting, food theft, and store break-ins. Families would do anything to feed their children. The moral dilemma shifts from law and order to basic survival. Experts predict a crime wave driven by necessity, not greed. With millions hungry and no safety net, the social fabric begins to tear. 6. Children at risk, the silent victims. Children make up nearly half of all SNAP recipients. Schools that rely on free meal programs would be overwhelmed by hungry students unable to concentrate, learn, or even stay awake. In the short term, teachers would see malnutrition and behavioral changes. Long-term effects would be devastating. stunted growth, weakened immune systems, and lifelong academic setbacks. Pediatric hospitals would see spikes in emergency visits for hunger-related illnesses. America's future, its children, would pay the highest price. 7. Public health crisis. Hunger isn't just an empty stomach. It's a medical emergency. People with diabetes, heart disease, and chronic illnesses rely on consistent meals to manage their conditions. Without SNAP, millions would skip medications or meals to survive. Emergency rooms would fill with malnourished patients, and healthcare costs would soar. Ironically, the government might end up spending more treating the consequences of hunger than it saved cutting SNAP. Nutrition experts warn that within months, America could face a nationwide public health crisis, a scenario not seen since the Great Depression. 8. Political fallout and civil unrest. The political reaction would be explosive. Protests would erupt across cities, demanding answers from Washington. Governors, especially from states with high poverty rates, would declare emergencies. The federal government would face massive public pressure to restore benefits. Lawmakers would scramble to pass emergency food relief, but bureaucratic delays could take weeks, time millions don't have. If unrest spreads, it could even destabilize local governments. History shows that when people can't eat, societies fracture. 9. Impact on the food industry and prices. Meanwhile, the loss of 40 million paying customers would wreck the food supply chain. Farmers would be forced to dump unsold produce, distributors would reduce shipments, and smaller brands would vanish from shelves. Ironically, while millions starve, food waste would rise. Grocery stores in wealthier areas would struggle with overstocked goods, while poorer neighborhoods face empty shelves. As demand patterns shift, food prices could either crash due to oversupply or spike due to logistical chaos. Either way, the system becomes unstable, hurting everyone from farmers to consumers. 10. The human stories. Faces behind the numbers. Statistics are easy to ignore until they have faces. Imagine a single mother in Detroit working 2 jobs who suddenly can't buy dinner for her kids, or a veteran in Texas who's forced to skip meals to afford rent. These stories would flood social media, sparking national outrage. The emotional toll, stress, anxiety, depression would skyrocket. Suicide rates could rise among those already living on the edge. Hunger is not just physical pain. It's a deep psychological wound. 11th government response. Emergency action. Eventually, the government would have no choice but to act. FEMA, the USDA, and local relief organizations would launch emergency food distributions. Temporary benefits or digital vouchers might be rolled out. However, rebuilding public trust would take months. The damage to families, to health, to the economy would already be done. This crisis would expose how fragile America's food system truly is and how dependent millions are on a single government program. 12. Lessons learned. The fragile web of support. The overnight loss of SNAP benefits would reveal a painful truth. Hunger in America is not about food scarcity, it's about access and policy. SNAP isn't a luxury. It's a lifeline that prevents millions from slipping into starvation. The crisis would prove that removing this safety net doesn't just hurt the poor. It destabilizes the entire nation. In the end, the biggest question wouldn't be what if SNAP vanished overnight. It would be, why do we let so many people depend on a single thread for survival in the first place? Conclusion: if 40 million Americans lost SNAP benefits overnight, the country would descend into chaos, economically, socially, and morally. Hunger would spread faster than any virus, crippling families and communities alike. This scenario isn't science fiction, it's a warning. The line between stability and crisis is thinner than we think. Like, share and subscribe for more.